Today, we have with us two stalwarts, but before that, let us look at the vision of our honorable president. He has given video, he is not in town, otherwise he would have been present today. He is away to Bhutan, which is one of our SAARC countries, for a conference. So let us hear from him his vision for today's lecture.
I'm so happy today on the launch of medical series for public awareness being organized at South Asian University. For quite some time, we were feeling that the faculty, employees and students of any university should be aware of common diseases, their prevention, their possible causes, so that they are able to handle the things properly and in time. Keeping this in context, I requested Dr. Ashwini Kumar, a celebrated medical practitioner and a very versatile individual, to organize this series for us. I'm thankful to him for having accepted to do that. The very first lecture which we are organizing today in the university is on eye diseases, how to early detect and take care. And the speaker who has agreed to deliver this lecture is one of the most celebrated ophthalmologists of the country, Dr. Jeewan Titiyal. He has been working at AIIMS for quite some time and is now also chairman of several institutions, including AIIMS Rajkot. I am very sure his talk today will be very enlightening to the audience, and we will continue to have such eminent medical professionals talk to the audience from time to time with the help of Dr. Ashwini Kumar. I congratulate SCU for organizing this series and hope that this will serve the intended purpose. My best wishes.
Alright, we just heard his vision, and basically that's what I said to you, that we have today two celebrated people who are not only celebrated but professionals also in their own fields. So let me first introduce Dr. Ashwini Kumar, who is basically the curator and designer of this program and who has been doing this at various places, including India International Center. Well, he is a professor of medical science, received various recognitions, prestigious award like Dr. B.C. Roy Award for Eminent Medical Teacher for the year 2014, conferred by the Honorable President of India in 2017. He has been a representative of Delhi University and Medical Council of India. Besides that, he has various assignments, projects from World Health Organization on socio-medical campaigns. Besides this, that's why I said celebrity. He's a top class kalakar, actor, song. He will recite song for you. Maybe today if his mood is there, then he will do that. So he's a reputed actor, worked in various television films, documentaries, serials, soap operas, namely और फिर भी गांव के जमाने में हम लोग फिर वही तलाश, इत्तेफाक से, अनुराधा, न्यायाधीश, to name a few. And he is also on All India Radio in 4 languages, which is a rare thing: English, Hindi, Urdu, and Punjabi. Top class. Well, friends, with this introduction, let me invite him to the dais, Dr. Ashwini Kumar. Our main speaker today is none other than Dr. Jeewan S. who's a Padma Shri awardee, who has dedicated his life to the, through AIMS, because he has been professor, head at the Center of Eyes, everybody knows him. And I have just met before this once, and I'm a fan of him. He's such a celebrated doctor, top class ophthalmologist, well-known ophthalmologist. So, let me invite, because other introduction will be given by Dr. Ashwini Kumar about him. Let me invite him to the dais, and I request our superintendent engineer, Titiyal sir, to come and join this one. Now, let me hand over the dais to celebrity Dr. Ashwini Kumar. Now he will run the program and he will take it forward till the end. Over to Dr. Ashwini Kumar. Thank you very much.
Namaskar, dear Sajjanon. Good evening, ladies and gentlemen. I, Ashwini Kumar, on behalf of South Asian University, the university established by Sharp Nations, welcome all of you to the newly organized medical series on public awareness. Based on medical presentations for prevention and management of diseases and conditions in a manner understandable to all our medical consultants of eminence and recognition all around in the medical domains. Eyes are the most essential and expressive organ into the world. कई नामों से जाना जाता है, कोई आंखें कहता है, कोई नयन कहता है, कोई पलक कहता है, कोई चक्षु कहता है। वैसे आंखों के बारे में बहुत कुछ कहा गया है कवियों ने और शायरों ने। किसी ने खूब कहा है कि हमको फना हो गए उनकी आंखें देखकर, कहता है वो आईना कैसे देखती हो? किसी से मिलते ही हैं तो आंखें नहीं बताते हैं कैसा व्यक्तित्व है, कैसा नाम है और कैसा है। नजर उठ गई तो दुआ बन गई, नजर झुक गई तो हया बन गई, जो तिरछी हुई तो अदा बन गई और नजर फिर गई तो कदा। हिंदी फिल्म की शायरों की तो बात ही निराली है। बड़े गीत बहुत कुछ उन्होंने लिखा है शायरों ने। आंखों ही आंखों में इशारा हो गया, हम आपकी आंखों में दिल को बसा ले तो आंखों में कहती हूँ पहला बादल मैं स्वतः नहीं बुलाओ क्या बनाए। शर्माना, लज्जाना, बुलाना, प्यार जताना, नाराज बुलाना, आंसू बहाना। आंखों के पास 9 रस है, श्रृंगार, लव एंड ब्यूटी, हास्य, लाफ्टर, करुणा, सॉर्रो, रुद्रा, एंगर, हीरा, हेरोइज्म, करेज, भयानक, शर्म एंड फियर, विवांसा, डिस्गस्ट, अद्भुत, सरप्राइज एंड शानदार। जब इतने सारे काम लेने आंखों से तो आंखें तो ठीक ठाक होनी चाहिए ना आपकी। डॉक्टर जीवन की ये सोच है, जरूरी नहीं कि हर समय लबों पर खुदा का नाम है, वो लम्हा भी इबादत का होता है जब इंसान किसी के काम है। Dr. Titiyal.
Very good afternoon, friends. I can see a mix of population, age group wise is here, and representing Sharp countries in this South Asian University is one of the motto behind Sharp country to improve the education amongst the entire this region. Not only to educate people, to improve the thinking behind keeping people healthy. Healthy doesn't mean being physically healthy. It has to be mentally up to that. Mental fitness is very important. And the society should be healthy. So that is how this South Asian University would be thinking. And today I am very privileged to be amongst you in this particular university. You just heard by friend Dr. Ashwini Kumar, who is the person multifaceted, multi-talented, as rightly described by Dr. Suman, he has so many things in his fist. Once he opens it, it goes to everything. I can't say the greetings like he said for so many languages, but I can only say Namaskar, good evening to the distinguished member of faculty of this university, the staff, the students, and greeting from that particular day which has been celebrated, the World Sight Day, the second Thursday of any year. And I've been doing this for so many years. And today I'm not in my institute, I'm outside in a different institute, bigger than a holiday institute of the science university, because in a South Asian university. Research has become a mega event for me. And thank you for being here, and thank you for invitation by Professor K. Talwar and my good friend who will be hosting this particular program of Ashwin. I remember when we started this special medical education program in the India Medical Center, I think I was the first one to start there also. And today also I am the first one to start this education series in medical health in this university also. Thank you, Dr. Ashwini, for that. I am such, which is the best gift what God would have given to us, which makes you see, which makes you understand, which makes you think, which makes you feel the environment around you, and also makes you think what is there inside your body also. Because through eye you see, and through eye you see your body also, both ways. So today I am going to take you through the common eye problems for which not only people suffering with various disorder or disease, even a normal people come to us. It's not only for the people who are suffering, it is for the people who are normal. They have to understand what are the most common problems which can be treated, which can be prevented, and which can be sorted out in a simple manner where you don't have to rush to big hospitals. So let's go through this talk, which is going to be a very brief description of various common things. And I would appreciate you if you have some questions, which I can answer them so that we are in a better session. So what is the various important reasons for which people come to us, to the ophthalmologist? Anybody here can say anything? Which is the most common reason by which a person can come to ophthalmologist?
So, using
okay, yeah, screen time and the digital devices is very good. Check eye is studying refractive error. Very nice. I think we have this common problem. Let's have the professor.
Sir, most of the time during changing weather, when conjunctivitis or those kind of problems, and then in the older age when you cannot see without glasses, then
Absolutely fine. Let me ask my colleague sitting here. I see Sarika sitting here. She can tell us she's been working in this area for last so many years. What has been her experience as an optometrist? Which type of people come to them?
So mostly the dry eye problem.
Dry eye problems. I think this tells us the various reasons why people come to us. Very nice. I think this covers my talk, entire talk. The first thing is people told us was the office is a redness, itching and watering. This can be because of various reasons. It can be sudden, as such as conjunctivitis, which we normally call an eye flu, which goes into like an epidemic. And it spreads so fast, faster than what we think. People say sometimes, if you see somebody with conjunctivitis, you will tell it. It's not that the seeing can spread the infection, no. It is so virulent, it's like a COVID. If you touch somebody, you can have this because it spreads by touching. Other thing can be gradual. We talk about allergies and something like dry eyes, You can have this itching, watering thing. It's the most common thing. Second common thing is the ocular pain. All of you would have experienced sometimes pain in your eyes, around your heads. Very, very common problem. And that can be because of various reasons, most common in refractive errors. Uncorrected refractive error. In Hindi, it's called dose. And other things can be glaucoma, infections, inflammation in the eye, or a trauma can cause this. But one other important thing which is serious is the loss of vision. If you lose your vision, that's a serious thing. You should not be sitting at home. Now, what are those important reasons for loss of vision? Anybody? When you lose the vision, any ideas?
There may be many reasons. One reason may be damage to the eye.
Trauma. Okay, trauma is one. Is there security risk?
Can we do cataract?
Cataract. Okay, very nice. Any other thing?
Mitochondrial mutation.
Okay. Loss of vision. Mobile phones. Not exactly.
Age.
Age. Okay, order disorders. I think you are from nice sciences, huh? Glaucoma, very nice. Let's see what you see. Sudden loss of vision, detachment of retina. Have you heard of this? Retinal detachment. Hemorrhage inside the eye, vitreous hemorrhage, or optic neuritis. The eyes are connected to brain by the nerve, which is called optic nerve. That's why you see. Something happened to your brain, something happened to your body, and inflammation, or some sort of, you can say, demagnetic disease, it can affect your optic nerve. It is called optic neuritis, inflammation of optic nerve. So you have a sudden loss of vision. But then the gradual loss of vision also, slowly vision going down. You see here, cataract, common. But you can have cataract at younger age also. It can be pre-senile, before you're called senile, or it can be capillary also, you're born with a cataract sometimes. But other things like glaucoma, I only pointed out one student here, or most importantly nowadays is, what is DR? Diabetic retinopathy. Because India is a capital for diabetic patients. So let me take you through in terms of blindness. We are going to blindness now. Blindness can be avoided, which is very important. Future way of thinking. So if you see here, we have two categories. One is treatable blindness, the second is preventable blindness. Treatable means when you already have a disease that can be treated. Preventable, which can be prevented. If you combine all of them, it is 90% of them can be prevented or cured. Only 10% of eye disorders are there which are cannot be treated. Those are genetic, hereditary disorders. So you can't do much at that. It is a very small segment. So we can prevent or treat 90% of cases. So these are various causes of blindness. But you see, top most like cataract, 66%. The rest is a small number, but they are huge. If you look into our country population, 7% is a huge. Take 1.4 billion. 7% is huge. It's the population of one country. So that is what is important here. Glaucoma, diabetic retinopathy, other disorders, and refractive error, they are all treatable. Let's go by age like this. First, I am taking you to the pediatric age group for children. See here, there are 4 or 5 things written here. Cataract, the right side corner. Congenital cataract. It presents like a white opacity in the eyes. Or it can be a glaucoma, the blue one, congenital glaucoma. This pointed doesn't come to the round state. Congenital glaucoma. Or you can have a refractive error. You can have the vitamin A deficiency, which is so common in Southeast Asian region. Sudden, dehydration, malnutrition, and not vitamin A deficiency, and that only involves the body, it can also take the eyes off. You can have a severe eye opacity coming. Or you're born with a defective eye, you can see the left side down picture with small eyes, microcornea, microphthalmos. Or you can have a premature baby suffering from blindness, which I will come to again. Let's go one by one pediatric cases. So you have this treatable, preventable almost 50%. If you see entire population 90%. But in pediatric age group 50% only because breasts are either congenital or they are associated with the deformities. So that will be difficult. So early pickup is very important. Today, world, India, Asia, many countries are worried about one thing in pediatric age group. That is refractive error. That too, which refractive error? Any life science person here? Raise your hand. Life science student? Nobody. Physics? Chemistry? Nobody. This is called myopia. The myopia is a very important thing to learn, not only for us, for everybody, because myopia is taking the world as epidemic. The percentage of people going to blind or suffer myopia is increasing every day. You can see here, if you look into school-going children, the prevalence in India is 15 to 20%, which is going to be more than 50% in the next few years. If you say 2030, 2040, 2050, by 2050, world's 50% population will be myopic. It's a big thing for entire world to look into. So therefore, we need to really look into this. So this is the WHO data. By 2050, half the population will be myopic. If half the population is myopic, they will be fighting for us. We'll become a pilot, we'll become your railway engine driver. So that's a serious thing we have to look into. And what other thing we can do for this is, one is demonstrate sustained little bit aside. And is it possible? Because getting rotated, then we should get it. So one important thing is a regular checkup. You people are sitting here, some of you are wearing glasses. I can see around 8 to 15% are wearing glasses here. So you are lucky if you are more than 50%. If you go to medical education, go to DD Highlights or some other school, medical school, more than 50% people are wearing glasses, spectacles. And that's because we have an increased requirement of near work for reading purpose, for all the digital devices which has become popular now in the last few decades, and that is causing change in the myopia for school-going children. Earlier we thought it would be limited to the urban places only because there are much more of a visual devices there. But now in the rural conditions also there are the same prevalence of myopia happening because the digital devices are also available there and everybody is looking to diagnose. So what we need to do is always look for a proper correction of a refractive error. So that is very, very important. And that can only happen if we have a good screening program in the schools. Every children going to school should be screened every year. If they are already myopic, we have to look for how to prevent further progression. Okay? Even in an institution like this, there should be screening program not only for eyes, but for entire body once a year. For staffs, for students also. Give a proper correction. Third is outdoor activity. One of the important reasons for myopia to increase is your outdoor activity gone down. Your body is not going through against the degenerative process which is happening there. Outdoor activity, you have more oxygen, you have more vitamin D, and you are physically better. The growth is better. So 1 hour of physical activity is important for every children now. So parents who are sitting here, make sure your kid goes out for 1 hour every day. In school also, it is compulsory to have a 1 hour break now. The other important thing which data nowadays we are doing is 2 or 3 things. Apart from the proper correction of a refractive error, we can go for a contact lenses, which are specifically made for a myopia control, or a glasses, which are specifically made for a myopia control. So these are called specific myopia glasses, which blocks the peripheral light range of focus we have. If you look at your eye, it's a spherical lens. Because in the physics students are here, they realize if you have a spherical lens, there is a spherical aberration. The center ray will focus into one particular area, the peripheral ray will focus behind. In myopia, that is what is happening. Your light rays are focusing behind. So there are much more incentive for the eye to grow, to focus those lights that are going behind. So we are defocusing those lights so that we don't have to really think of peripheral spherical aberration. Only central light are focused. The myopia stops progressing. Apart from that, we are giving a low dose atropine that also immediately progression of myopia. Apart from these contact lenses, glasses, and atropine, the physical activity I talked about is very, very important in this case also. Little bit on another important area. I'm saying this because now Indian healthcare has improved. The pediatric area has improved. The neonatal care has improved. In many children which are less than 38 weeks surviving, even at 28 weeks survives. But unfortunately, they can have age disorders. One of them is the lymphopathy of prematurity. And if this happens, child can go blind within a month if you are not taken properly. So if you have a little bit of concern, any child which goes through the neonatal ICU or oxygen to be given, or a child in less than 34 weeks must screen them, or a birth weight in less than 1.5 grams must screen them, otherwise child will go blind, and it's a medical legal thing. If you don't have a proper reference, proper center, you can be put into a medical negligence also. So timely detection, timely management can prevent this. So this is what we have learned about these things. Ocular allergy is very common. You can see various young children are suffering from ocular allergy. They keep rubbing their eyes are red, watering, they have a refractive error. And this is what happens, they can have large deposition of eyes, something like red eyes, rubbing. And these things, if they continue, you can have a lot of complications also. You can develop keratoconus, the eye can burn forward, cardiac shape changes, you can develop cataract, glaucoma, and corneal disorders. The allergy also is very, very harmful to the ocular surface because that ultimately induces dry eye. And dry eye is not good for the health of eye. So that is very important thing. Trauma, as you pointed out, trauma is more common in working age group, but it's more common in children because of various reasons. Playing, unsupervised playing, they playing cricket, they playing tennis ball, and it can hit your eyes. Similarly, the vascular injury, which is so common in the Southeast Asian countries, you have the cervical, the mobile injuries, bracket injuries. Once you have injury to your eye, you almost cannot be normal subsequently. So you have to prevent injury to your kids or yourself. Very important. And the commonest thing in Southeast Asia is chewing a betel nut. We call it palm. There you use tuna. And this chemical can injure your eyes because it comes in a package. You can see the toothpaste in a packet. And it has to squeeze to get that tuna out. And this can go into like a pistol. And can hit your eye, you can face, and this injury can happen, you can go blind. And with lot of efforts with the ministry, we could put a label onto these packages now. It is dangerous for our kids, keep it safely. Otherwise, those such warning signs are written in these. In fact, nowadays, if you have anything to be used as a consumer thing, proper instruction to warning has to be written into it. And that is what we could do subsequently also. So these are injuries because the tuna packet can see that cornea can get damaged and you can go blind also. So cancer injuries are really dangerous sometimes if not taken care properly, you can lose major costs. So this was the pediatric issue. So I have covered 4 important things. Lasting one trauma, it can be totally prevented. Once you have a trauma, you can never be normal. If you are lucky, it will be very minor trauma. Otherwise, you lose your vigilance. If you correct also, it can never be normal. Second was, the neonatal, premature baby problem. And third thing I talked about myopia. So all these are important. Any questions on myopia? Because I'm going to ask questions subsequently, keep remembering. Just come to the middle age group. Because one side there, everybody's eyes is important. We love our eyes, and it has to be kept as normal as possible, as healthy as possible, and as long as we live, the eyes should give you a perfect vision. And as rightly said, dry eyes are one of the most important things in this world age group. You people are the same age group. It's not that it's a disease of older age group. No more. It is a disease of the young people now. Because you are the people who are glued to our screens for 8 hours, 10 hours, 12 hours, 14 hours also. And more in the screen time, you will have dry eyes. Once you have dry eyes, if you don't take care of dry eyes, initially it becomes chronic dry eye. Then don't cure. Only thing what we can do is, save you from these symptoms only. Cure your symptoms. The cure cannot be done. Because once your clients are gone, they cannot be reactivated. Very difficult. To make sure you prevent your dry eyes. It is seen that if you see the Asian countries have or African countries have more dry eyes than the European or American countries. And our studies also, this is my study where we found that about 32% people have dry eyes coming to hospital. But people sitting in offices at home into it much more. So almost everybody suffers from dry eye symptoms. In a particular time of a year, it can be seasonal also. So these are various signs and symptoms you can have excessive watering. People say, I'm having watering, why are you saying I have a dry eye? But this is a sign of a dry eye, but with a reflex DNA happening. So watering doesn't mean you don't have a dry eye. You can have red eyes, you can have a decreased vision, you can have lid swelling, you can have so many things. And dry eye is one important reason for not having a good vision, clear vision, and having the ocular pain, headaches, everything goes together. This is what we talked about. People having some disorder like diabetes, smokers, glued to a display unit, display units. People are using contact lenses. People who have undergone refractive procedures, laser corrections. They all have dry eye. People undergone surgeries where you have cut the cornea. Because once you cut the cornea, you are cutting the nerve source. So once you cut the nerve, the reflex goes off. And you have more inflammation and dry eye in this case. So treatment is again, first getting a very early diagnosis. Knowing which type of dry eye you have. You can have the secretion getting less from the glands. Or you can have a lipid, which is a superficial layer of tear film. Lipid getting wrong, the lipid is not good. Or secretion less. Or you have excessive drainage happening. Or you have an excessive evaporation. Now if you have a tear film, because with each blink, new tear film comes. And that is how you see better. And normally, this tear film retention time is around 10 seconds plus. People suffer with dry eye, this tear film goes down stability wise. It can be less than 10 seconds, less than 5 seconds, sometimes 0 also, where you have no secretion happening these cases also. The treatment is according to various types of dry eyes. So we have to look into how to control dry eye. One is customizing your activities, your work areas, and similarly improving your health condition also. If I can ask some question to I can ask Sarika, I don't know what name. Sarika, what is 2020? Hello?
So first 20s look at 20 feet. 20 other 20s blink. After 20 minutes of using the screen, look at the 20 feet and blink 20 times. That is 20 minutes. For 20 seconds.
So this 2020 rule came because in India or a cricket playing country, the 2020 matches are going on. So we thought let's make something which is attractive and people will never forget 2020 rule. So basically, if you have worked for 20 minutes, in your system to just break for 20 seconds and go far away for 20 more seconds. So this will break your dryness cycle. Basically, it is breaking your dryness cycle. And above that, it at least blink 15-20 times going deep. So this will spread your tear film, and you have a new tear film which is applied by inflammatory cells or inflammatory mediators. So this is normally doesn't work 20-20 because people are going to work for longer. The new concept for me is, if you work for 1 hour, break for 5 minutes. You work for 2 hours, break for 10 minutes. Now, accordingly, you can customize your work profile. Never work continuously because your dryness is going on, you don't realize. You only realize in the evening when you have pain, watering, redness, headache. So this should be avoided. So you think of a 20-20 rule, so you realize you have to break in between when you're working in a system, reading books. Never read books upside down. There's a time reading book like this. Not a good idea. Sit on a table chair, read the proper head posture. The posture is very important. You can looking up like this, you have a more exposure. Your tears is going to break faster. If you work like this, your tears is going to retake for longer period. So walking profile is also very important. Secondly, never see your mobile phones in dark. Because many kids, they realize that their parents go to school them, they put blankets and they are doing inside the blanket and clean things, which is a bad idea. Let them work, but tell them you have to break from the audio. Give them a larger digital devices. Larger device, you have to go further away from the devices. So if you have distance, you would have less power to your eyes. So distance, larger screen, less radiation from the screen, and giving break in between. I think needed putting a lubricating drop in between very important for preventing this particular disorder. And this I talked about, and let's go to other area. This I thought I put 2 slides because I knew that in university there are students here who are wearing glasses. They all want to know can we be without glasses, can we be off glasses, and that is segment in refractive surgery, where we correct your refractive apparatus, that is cornea, by remodifying the laser procedures. The later written correction can be done for those people who are more than 18 or 19 years. They have a stable refraction for more than 1 year, and their cornea is healthy enough to undergo refractive procedure. Okay, so this is done for various reasons. These are various types of refractive procedures. Can be done for myopia, can be done for hyperopia, up to 13 diopters, up to 6 diopter cylinder you can carry to the various laser procedures. But normally we restrict up to 8 diopters, -8 diopters of refractive error for laser correction, plus 6 diopters of hypermetropia, plus glasses requirement, up to 3 or 4 diopter cylinder. If you have more than that, then we have a different surgery that is called ICL surgery, which can be done in these cases also. So any question on refractive surgery, let me see first. Do you understand what we talked about? Yes. You have a question on that? You don't want to certify that? Why? Okay. She knows that. To try and you want side effect of all laser procedures. What about you? Don't know the question? Not right. Not right. But sometimes these can be expensive because they require a lot of money also. And somebody has to pay for these procedures because they are cosmetic surgeries. And they don't reimbursement for cosmetic surgeries. But the parents should say, from where I get out that money? In India, the average age for refractive procedures like this is around 23 years. Because parents are paying for these procedures. In US, the average age is 28 years. Because there people pay from their pocket. So that's the difference. Younger the age group, I think you have longer benefits for you because after 40 years you have some other problems that will come.
In general terms, is it safe to go for this? And do you advise that yes, young people can go for
So that's a very, very good question. I thought somebody will ask me this question. So it is one of the safest procedure we have today and one of the most predictable surgery in the body. If I want quite 0-1 application can be done with this. The outcome is absolutely predictable. I'll come to that. Because I said 19 or 20 years. So this is the same procedure. But only in that situation where we have done a good screening of that particular person. There are a lot of guidelines where patient may not be suitable for this procedure. Based on a corneal topography, dry eyes, other associated disorders like patient suffering from other things also. But if patient is suitable, it is one of the most successful surgery. And people go for these surgeries. As older age is concerned, where they have two types of iron at that level, one for distant, one for near, which is called breast biopsy. We do have pressure for those also, but normally it is not very difficult. So it always better to avoid surgeries from the ordinary group if they are okay with glasses. But sometimes we do have now, earlier we never used to do for ordinary group, now we do for them also because sometimes they have -6, -7 for distance. That can be corrected and they are left only for the encouragement. So this is what Prasad is talking about, breast biopsy. I put this segment here because this is the largest group of population in India or world over who have this error. This is a physiological error. Because once you cross 40 or 45, you require near correction to be done. Because your lens, the natural lens, cannot accommodate for near, which you can do in a very easily. So this is called breast biopsy, and huge number of people, they have no idea they can be corrected also, especially in rural areas. Or if they don't have also, they don't have the power or money to buy these glasses also. So there is a serious understanding of ministry also to provide screening for these people and screening and giving glasses to these people also. And this is a huge segment across the world of almost 1.8 billion people are suffering from breast biopsy. In India, it's up to 62% of people are more than 40 years. So this 62% more than 40 years is a huge number. And how many of them are actually using corrective glasses are also very difficult to predict also. In breast biopsy, there is a very thin best in the glasses, which can be bifocal, which can be multifocal, progressive lenses. You can go for correction also very ways. Let me briefly take a look at glaucoma. Why glaucoma is very important to understand?
Irreversible change.
Okay. I think you're not good. Any idea? She rightly pointed out the once glaucoma called blindness, it is irreversible. If you have cataract, it is reversible. We can do cataract surgery, which is called motia in a proper form. You do surgery and vision comes back. In fact, your vision can be better than before. When glaucoma, which is or kala motia, once it happens, it damages the optic nerve, no reversal. That cannot be reversal. Therefore, early identification is very important. So you must know these 4 or 5 important things and just avoid this. So these are important things to understand. Please see carefully. Who are those people who are prone for glaucoma? Most important thing is, people having a family history of glaucoma in their family. In maternal side or paternal side. That way over 40 years, people suffer from refractive error, like high myopia, injury to eye, especially ball injuries. Then we have people with taking steroids for long term, first for allergies, for a skin problem, for other things, taking steroids which are tablets or drops, patients undergone surgeries, or patients suffering from diabetes, hypertension, chronic smokers. So these are people they can have glaucoma. The one thing that stands out in this particular chart is age over 40 years. So you have a high incidence of glaucoma. The 40 years is one cutoff for our examination of all of us. Because that is the time you can have near vision requirement, that is breast biopsy. That is the time you may have initiation of glaucoma, and that is the time you may have some cataract formation also. The one examination from 38 to 45 is very important for all of us. And if you have some history of eye disease, some diabetes, hypertension, every year you should have a check. So this is what happens with glaucoma. In middle picture you can see the red growing thing is the retina picture. And the circle thing is the optic nerve end. And in that one, the whitish part is the nerve fiber going through that to brain. That is called, the central part of this. If that white part is larger, that means your disc is there. It has to be throughout. So this is a typical glaucoma that is happening to optic nerve. And you can see that right side picture in the field chart. Each eye has a field of vision. You see superiority, temporary, inferiority, field of vision. So once you have a glaucoma, this field of vision affected, you become narrow, and one time you have just narrow vision, and suddenly you lose the vision loss. So this is what is I'm showing this because you should ask when you go for a spectacle correction, when around 30, 40 years, you ask them what is my pressure. What is my eye pressure? One question to person will bring your refractive correction. What is my retina looks like? If you have a fantasy, please do my field testing. If not, the entire screening of nerve fiber layer or ganglion cell layer, which is there which is a high-end investigation of glaucoma patients. For a screening, you must ask always, what is my pressure, doctor? What is my retina looks like? Two things, which is going to save you from glaucoma of the future. Treatment is not very important because it can be lasers, can be medicines, but that will be once you have a patient suffering for this. The last thing is damping antibiotic. Because I can see the retina picture here. In damping, what happens is it affects the blood vessels. The damping antibiotic. And see so many red dots happening, averages, and the central area of macula can get elevated and lose vision. So before this happens, you have to have a screening. If you have the diabetes, you must understand it has to be done with the proper dilatation of both eyes. Then it examined. If possible, the last picture is OCT. That is called ocular coherence tomography, like a CT scan of the body. So it gives you a section of retina. There are 10 layers in retina, and that can be seen by this OCT without cutting the eye. And that is the advantage we have in the new investigative tools. You can see the entire retina is swollen here, and this patient requires treatment. So any patient with early damping antibiotic, we have to do a medical regulation, strict diet regulation, physical activities, control your blood sugar, control your cholesterol, lipid level, and do some exercises. And if you have some other disease, then you make it an injection inside the eye to decrease the growth of blood vessels, decrease the swelling in the retina, and they require treatment surgery also. The other thing is, takes away vision over age in the degeneration. Degeneration is happening in the entire body, but it happens in the eye also, and it affects the retinal central area, the macula, which is called macular degeneration. That can also take care of your vision getting out, and it gives a central scotoma. The central, the middle you don't see anything. In periphery you may have a vision because central part is affected. You can see the scar happening in the retina, the central area, and this is how you see you see the face of a person. Normal person will see clear. A patient who has a macular degeneration, the scar, will see the central totally black and peripheral vision will be there. So if you have these symptoms, the patient has a macular degeneration, what we give, normally give this chart. That's called absolute grade. And patient with a macular degeneration will see those distorted lines. So people suffering, they should take a chart. Once they should do it also. All the lines should be clear and straight. Any line is distorted, that means there's something going wrong with your head. So that's a very good test. These are all available in the nets also. The Google, you can download them, you can do every day. And this is the angiography telling the entire scar. See the OCT picture, things are growing a little retina and causing damage to the retina also. So these can be treated also, and you can prevent blindness in these cases. The number will be increased. Why? Because disease process not increasing, but the people surviving this age group has increased. The life expectancy in India has increased. So this life expectancy increase is good. That means our healthcare system has improved. But if you survive beyond 80 years, your life should be healthy. The quality of life should be good. Otherwise, what's the point living beyond 40 if you don't have good quality of vision, good quality of life, you can't hear, you can't listen, you can't see, then what's the point? So we have to all look into this direction to improve this part also. Which advertisement of us need to take future excellent growth area also. The quality of life is basically depends on all the vision. Having I can class is a critical cause of blindness. India, large number of people suffer from blindness. But good thing is, we are doing a very good service to these people. Last year, India did almost 90 lakh surgeries in India, which is almost 1/3 of the entire world's total cataract surgery. Despite that, we have at least 2 crore people waiting for surgery. It's a huge number. But best thing is these surgeries have really given a good outcome. It's not like 40 years back when people were suffering from cataract, even blind after cataract surgery. Almost around 30% of people are getting blind after cataract surgery also because of complications. That has come down to hardly 70-20%. So it's a good thing. Training has improved, the quality has improved, and especially the surgery techniques have improved. You have lasers, robotic surgeries, good lenses, which improves your quality of vision, and people really find improvement also. These are very special lenses now which are commonly used. These type of picture gets a center part eye white thing, which is a hypermature. It can mature, but it is not beyond maturity. You know, hypermaturity is hardly seen nowadays. We don't want this to happen. You want to operate a person when they start having difficulty. You may say your vision is 6/6. That's a normal criteria. But you have a difficulty in 9/9. You are not able to do a good near work, so that's the indication of surgery. The indication is based on a patient requirement. And it is an elective surgery for all of us. So mostly, if you see bigger impairment adults, if you look at future-wise, I see 3 sectors. One is the school-going children, myopia and vision concern. The middle-aged, office-going people, dry eye and vision problem. And people who are towards the later half of their work, plus parallel as the problem. People who cross 60 years, diabetic retinopathy, age-related macular degeneration, and the cataract is the problem here. But most importantly, they are all can be treated and can be prevented. But magnitude of these problems is huge in the country. Huge. We can't screen people from glaucoma across the country. Very difficult. So people have to know these features of a glaucoma, features of a diabetes, because some glaucoma have no symptoms at all. By the time they should come to us, they are already blind. Because by the time they realize the vision is going down, it's too late. So therefore I said those, risk factors have to be known. These 3 lines are very important. Your eyes are your windows to the world. That's can you see the world. Your eyes are the windows to your soul. That's also very important. But that is also very, very important, which I said in the beginning. Your eyes are the windows to your body. This I am saying this. If I see through your eyes, I can diagnose various diseases happening in your body. I can pick up diabetes, I can do a hypertension, I can pick up degenerative cancer, autoimmune disorder, anything. You can diagnose by seeing the eyes. The eyes are such a precious thing for not only seeing, but seeing inside the body what is happening. I can predict what's going to happen with your diabetes next 10 years. I can predict when you're going to go blind also. And there are new AI-based systems that come to help you in diagnosis, treatment, and prediction also. Recently, Google has acquired the one AI-based diagnostic where they can predict when you're going to have Alzheimer's. It's not eye disease only, the systemic disease can also be picked up by seeing the retinal vasculature. But AI is very important thing. I know people are sitting here with a biotechnology, engineering background. They should be looking for developing something on AI-based technology to actually pick up these preventable blindness cases. And coordinate with your body-related disorders also. Devise something which can be handy to the for masks. I say masks because People cannot come to us. The people sitting across the country, we have to go to them. And that can be possible now, like we have the digital media available across the country, net is there across the country. Why can't we develop something where people are sitting at home and diagnose from there, and with a telemedicine we can treat them also. And that is what we are doing nowadays. We have a very advanced telemedicine facility. We have a very advanced AI-based diagnosis for retinopathy, for glaucoma, for cataract, for keratoconus. Now it's going to come for myopia also. So things are changing very, very fast. Today I'm talking on this, tomorrow I'll be talking only on AI-based things, which is the future for a good thing also, for a bad thing also. Because if I just see my change happening, because I was in an institution first, where people used to interact with me for 1 to 5 minutes only. Today people can interact with me for a half an hour, 1 hour also. Because I don't see those many patients. The patient comes to me, doctor, yesterday you took a picture of my retina. And I put that in ChatGPT, it says these things, please explain. And he said, this is the treatment that please explain. Who can fight with a ChatGPT now? Because if you say this is the retinal picture, so direct illumination, you say it can be tumor also, it can be choroiditis also. It gives you 100 diagnoses. 100 ways to explain that. As a physician, you become very difficult. So these things can be challenging to all of you. Make sure how to take those noise out of our practice and get the best out of these new technology also. There we have to work it out. I hope this brief thing on various common eye problems would incite something in your mind and body to educate yourself, to your parents, to your youngers, to your fellows also, so that we remain healthy through our eyes. Okay, thank you so much. If there are any questions, I will take it. Before I ask the question, any questions? Let's see what we need them on the
if someone has if someone has a lazy eye, then what you should do?
Very nice. So this is a question based on lazy eyes. The lazy eye one is you have 2 eyes. So both eyes have to coordinate together to achieve binocular function, binocular vision, stereo activity, stereo is very etc. That can only happen by both eyes working together. So whenever you have one eye that is suppressed, then the vision is lost in that eye. During the developing phase, that is early childhood. Therefore, the importance of taking refractive error early, within first 4 years of your life. The people who are sending their kids for a pre-nursery, nursery checkup, eye checkups are very important that time. So they pick up, these undiagnosed refractive error, which may be caused for lazy eye to one. Because one eye may have a high refractive error, other eye may be normal. The one eye takes over, which is a dominant eye, other eye may be suppression. Imagine if you have 2 kids. Let's say they are twins. So one kid may be better, one kid may get better. They always that happen. So one eye can get suppressed. So you have to make sure other eye also picks up. The treatment there is to correct the refractive error. And secondly, make sure other eye is forced to see. That can only happen by closing the other eye. So we have to close the normal eye, or sometimes so that this lazy eye can see further and improve the vision. And that happens within the first 10 to 12 years of life. If somebody comes at 20 years of age, then there is hardly any chance to improve. So early diagnosis can say. The one can be refractive error, which can suppress the other eye, or it can be other causes, where the vision cannot go inside. We talked about opacity, cataract, congenital cataract, or patient having congenital corneal opacity, which blocks the vision going, light rays going inside the eye. So you have pathology, you have no pathology also. So normally these are called ablactic eyes. Very good question. Any other?
So, I just wanted to know that if somebody has dry eyes. So artificial tears can be taken on their own or has to be consulted with doctor.
That's a very good question. I just wanted to highlight, I didn't highlight this because I knew that people are knowledgeable people. But what happens in India, there are a lot of medicines are picked up unregulated, without the prescription of the doctor. This is good for the country, this is bad for the country because you have freedom to take any medicine from anywhere. Like you go to US, you go to UK, you can't take any medicine unless there is a prescription. You can't go to the specialist unless the general physician refers here. The long waiting queues for MRI you might take 3 months by the time you have brain damage. India, this is not a situation, but there is a negative factor also. The chemist can give you any drug, which maybe if you put it unknowingly, it can cause so many other complications also. But there are some medications which are free of complications. In this, you can take lubricating drops or dry eye drops, we call tear drops, can be used. But they should also be supervised. Second is antibiotics. You can use for a particular time. But it should not be used unjudiciously. Because these are drops or a medicine coming to us with a lot of research. To find one molecule can take many years of research. And if you damage this molecule by getting resistant to this molecule, the preservation of a new molecule is also very important, and it is up to the physicians and the public to do diagnose. So I described you the new generation antibiotic, chloroquine or doxycycline. Use it for anything. Tomorrow, when you look at action for infection, it will be resistant. So preserving these critical molecules is all responsibility also. While dry eye patients require a long-term use of these eye drops. So normally eye drops come in a bottle. Those are called dispensers. And these bottle can be used for 1 month at least. It can be used for 1 month because there is a preservative added into the drops so that this bottle remains unstuck for 1 month. These preservatives can kill this infection which is coming from outside. But these preservatives are toxic to the eye drops. So if you have to use for long term, you should decrease these preservative medicine for your eye drops. Now we have the cabinets of a drop without the preservatives. So these are called preservative-free medications or drops. So if you have to use for many years, go for a preservative-free. That will save the ocular surface because dryness can be worse with the drops sometimes. And never use the medicines, devices beyond the prescribed limit. So I say you have to use contact lens for 1 month, it is only for 1 month, not for a 35 days. If you have any disposable, dispose every day, don't use next day, otherwise you have a complication. The advice should be read and practice as per the guidelines.
I am the next I have a question. How far is eye donation successful in our country? And do you see as a very senior doctor that digital eye is going to replace the donation of eye? Yes, I look at it. Thank you.
I think that's a subject which is for the society. Yes. Eye donation is going on. There has been a shift in acceptance in the society. Because donation happens at a time where we have family activity. It was very difficult for us to motivate the family to donate the eyes of their next kin who had died last time. Person may have place for donation. It doesn't matter. Because the body doesn't belong to that person who was already dead. The body belongs to the next of kin. Those are parents, or their sons, or their most near relatives. Unless they say yes, we can't take it down. There is no law in India to say a person has pledged before, we are free to take it, we can't take it. But numbers are increasing. Acceptance is increasing because awareness has come amongst the society. And people know that organ donation and tissue donation is an important part of life. But unfortunately, despite that, we are far behind in approaching a normal, when we can say we have taken care of the background. If I say eye donation and eye transplantation in India, last 2 years, we have collected around 55 to 60,000 eye donors. Of that, 50% are utilizable. Only 25,000 surgeries are being done. The requirement is per year we have to 1 lakh surgeries. Imagine how much is the backlog. To do a 1 lakh surgery, you require 2 lakh hands. To do a 1 lakh surgery, you require 1,000 surgeons. And no many institutions. It can be done. We have more than 1,000 surgeons, but we don't have the number of hands. There is a question, can you work on something else? The people are working on a synthetic eye now, synthetic cornea, which can replace the human cornea requirement. But there will be a time when maybe entire eye can be replaced. There are situations where we are putting the chips in the blind person's eye so that he or she can see like a normal person. Because those chips can take the images into the brain and you can see. But that is going to take some time. That will happen. Because if you think of something, it's going to happen. You never knew we'll have the mobile phone with us. You never knew we'll be having the video talks from University of India. When it happened, if you see the whole movie, they're all there. People have thought about those, and that's why it has happened. So there's a possibility that the entire eye can be contented on our genetic study wise, and there is a genetic treatment going to come to take care of those 10% of people where I said cannot be treated. There, a lot of gene therapy work is going on to treat those congenital hereditary disorders also. But just now, the difficulty is going to have some sort of eyes which can replace the human eye. But we have the devices now. We have basic devices where blind person can see. If you put those goggles, glasses, they have a camera attached, they have memory. Hidden into them, if I wear them, I put my eyes low, you can say, okay, there's a person standing, sitting, 2 meters away from you, wearing a black jacket, with a curly hair, spectacles, and even a voice can also be able to do. So these are quite helpful in those people who become blind after they were seen, because they don't have that. But it's a little difficult for a person who already was blind right from the birth. So these goggles are available and they're quite helpful in those people who suddenly become blind because of disability. Any questions, sir? They're not asking any questions.
Let me ask, sir. Sir, first of all, thank you. It's a wonderful talk. I think very educative. Please, okay. One common problem after certain age is the floaters in the eye. That is one. Second, you talked about autoimmune disorders through eye, but it also happens with the young people. So how to really detect and prevent these kind of problems? Sometimes autoimmune is genetic, so that is also very, very important. Thank you, sir.
I think floaters sometimes may be very bothersome also. But floaters are things which are moving with your eye movements. Because if you see up, down, right, left, your eye moving, there is a fluid inside the eye which is called gel, and that is vitreous gel. Gel means it's a little thicker fluid, and normally it is clear. But as time passes, there can be some pigment release from your retina, from your tissue into that gel. On that particular small pigment can move your eye and can look like something floating in front of your visual field. But sometimes there can be degeneration of your vitreous, and your fibers can become a little opaque, and that can also look like a entire thing moving in front of your eyes. But serious thing in those cases where you have the degeneration in the retina and the periphery, where from the pigments are getting released. It can be a thick retina. It can be a thin means like suppose I am wearing the clothes here, and after 10 years this will become a little messed up. Because as time passes, this texture also goes down. Same thing happens to retina also. And these thick areas can lead to pigment, and sometimes they can be a small bone also. And this bone can get the retina to detach also. So there is always a risk of a detachment in this case. Therefore, once you see a floater, you take one examination retina, you see the entire retina, things are alright. If things are alright, nothing to worry. There are few things important here. If you are seeing one or two floaters, but certainly one day you see thousands of floaters. So there are flashes of light coming in your eye. So this is an indication of retina is a serious threat. So that's a high risk thing. So sometimes, especially older age people, or sometimes we do cataract surgery or glaucoma surgery. What happens in those cases? The gel is attached to retina in various places. And this attachment can cause no traction to the retina. And this traction causes flashes. And once the pictures getting detached from those areas attached, that can also cause floaters. Once you have a complete detachment of this picture gel from the retina, then your floater will shut it down. So we always know for those patients, they have an incomplete detachment. We keep checking them until they have a complete detachment. Once they have complete detachment of this gel from the retina, then no threat at all. So the two, three things are very important. The other questions are asked was, regarding the autoimmune disorder. The autoimmune disorders are those where your body has antibody against certain antigens which are there. Your body knows, or sometimes it is initiated by your body. Like let's give one simple example of a vaccine. The vaccines are foreign tissue injected in your body. It can be a virus, it can be a bacteria. Their proteins are injected, so that your body develops antibody against the protein to subsequently defend some of this. There is disease or disorders which can be totally autoimmune, like arthritis, that rheumatoid arthritis. The rheumatoid factor is there, which is caused autoimmune disorder. Thyroid. The thyroid is totally autoimmune disorder because you have developed antibody against your tissue, thyroid tissue. So these can cause, apart from systemic disease, it can affect eyes also. In eyes, it basically affects 2-3 areas. One is the white part, which is called conjunctiva, the white part of the eye. There you can have a recurrent inflammation. Or it can cause the inflammation inside the eye, which is called uveitis. The cells that are not supposed to grow cells inside the eye, they have started leaking cells. So that can be a damage sometimes. Or sometimes you cannot develop pathology. Also, weak blood vessels in the retina can get inflamed. So there are various presentations of autoimmune disorders, but most important one is the dry eyes. This is most important because I said the surface gets damaged because of antigen antibody reaction. So once you have the first thing is control systemic disease first, that will also handle the eye also. Then treat the eyes as per the symptom. If the patient is dry eye, give the dry eye treatment and the systemic treatment. Normally, they are either steroids for some time. Then we give other drops to decrease the systemic immunity in those cases. Okay, we have one question.
My name is Suman and I am a PhD scholar from Faculty of Arts and Design. And so my question is, how many hours should we get in a day at minimum for the sleep? Or if we are not able to get that much sleep, so is there any option or way to avoid their negative effect?
It depends on what age you are. Normally, classically said you should have 8 hours of sleep, which is not possible most of the time. So this 8 hours can be continuous sleep, it can be divided into various time frames. But if you have 6 to 8 hours, that's a very convenient time of duration of sleep. Sleep means proper sleep, deep sleep in those cases. But if you don't have those sleeps, that can reflect onto your work profile, And you will not be feeling very, happy with your day one because this is tired. That means your sleep is not being proper. And for that, you have to compensate by taking you off in a daytime also, maybe half an hour. So that stress of complete sleep can be taken off. Even can be possible. It can be. Other thing is, you have your body, requires a lot of hydration at that time. You have to take more water so that your body hydrated. Because hydration is also very important. Significant total amount of oxygen going inside the eye. The oxygen also very important factor in this case. So if you work in an open area where you have more oxygen, you will be better. So it's not only the sleep, the amount of oxygen going to your body is also very important. The oxygen and the hydration too important to relieve the sleep stress.
So big hand to Dr. Jeewan. देखो कितना कॉन्फिडेंटली बोलते हैं अभी जानते हैं गोलीबाजी नहीं कर रहे फैक्चुअल बात करते हैं और एक आपको मौका मिला था तरह के मुख्तलिफ किस्म के सवाल से करने का आपने किए भी हैं बट दिस इज द बिगिनिंग ऑफ this journey, this is medical journey which will continue for long and you will be educated for many common diseases, the management so that you don't suffer from it. लॉन्ग रन में आप ठीक ठाक रहे हैं यहाँ से पहले तो दुआ में और माइग्रेन को और उसके बाद जिसे कहते हैं ना दिलीप को अंदाज में हम है ना